What is up, guys? So today we are back again. No Gary today. He just didn't show up. He just doesn't like engaging with the podcast. He hates you guys, right? It's just, I have to unfortunately let you know. But fortunately enough, we are joined by someone who is much more educated and much more, let's say, adept at discussing the topic at hand today, which is, we'll call it female fitness, right? There's a lot more to it. There's a lot more nuance we're going to go into, but female fitness is onomatopoeic, it kind of rolls off the tongue nicely. So we're going to title it that. But today we have Nicola, Dr. Nicola. She is our resident doctor and our resident female specialist, I suppose you'd say, women's health specialist, women's body composition specialist, just specialist in women. And we'll get Nicola to introduce herself in a second. But I just want to say before we get into that today's episode is a little bit of an intro episode to this kind of series that we're going to run on, again, this female health, female fitness, whatever you want to call this stuff, right? And the reason we're going to do this intro episode is, well, first of all, there's a lot to discuss. As you'll see over in the coming episodes, there is a lot of nuance with this stuff, and there's a lot of, stuff that you have to dive deep into. And if you don't have the requisite background knowledge, you're always going to be left going, wait, what do they mean by that? Or how does that relate to this other thing? So we kind of have to build your knowledge over the next few episodes before we can really get into the nitty gritty stuff, right? So with that in mind, this is an intro episode, and with all intros, we want to have an introduction, and the introduction today is to Dr. Nicola. So who are you? What do you do? Like, who is Nicola?
Well, Patty, thank you for having me on the podcast. My name is Nicola, and I've been a coach for the last couple of years. Originally, I was in-person personal training, and then I moved to online with Triage back in July, because I started as a junior doctor down here in Waterford. So I'm currently on my surgical rotations, and with Triage, I suppose I'm mostly focusing on women's health, women's strength training and nutrition. And I suppose this is what we wanted to do the podcast about, because I think that there's a lot of noise recently about women's health. And I think it's something that's being kind of thrown around a lot, and there's still a lot of misinformation going around. And so I suppose, like Patty said, is we want to get some background knowledge on women's specific issues, women's health, different life stages, and build on that over the next couple of weeks. But I suppose what I primarily wanted to focus on this episode is, I suppose, talking about the differences in these life stages. Because I think, from talking to, friends, family, they're like, well, what is the difference between men and women? Why are we, there is no difference. Like, why are we kind of almost regressing when we're talking about this? And I know me personally, when people used to bring up, differences between men and women, I'd nearly get defensive about it. It was nearly something that I would find sexist. I'd be like, there's no difference. I can train just as much as a man and I can do whatever. But really, I think that's actually quite counterproductive to ourselves and to our physiology, because there are some key differences, and like I said, like big life stages that women go through. So I think, it was definitely doing a disservice to my old self, and to the women around me by kind of having that attitude towards it. Mostly that. And then
Also, this is the thing about, like, again, this female fitness stuff. First of all, there is no real right and wrong with health and fitness in general, right? There's obviously shades of gray. There's, better, worse, but it's a really hard landscape to navigate, purely because you can often find yourself in a situation where you think you are doing the right thing, or you think you're in a let's call it a frame of mind where you're like, this is the frame of mind that I should be in. And it's not necessarily entrenched. It's not like, oh, this is my last stand, this is the hill I'm going to die on. But you can have a more, let's call it, emotional reaction to something when you hear something initially. But like you said, as you actually learn a little bit more, you start thinking a bit more deeply about this stuff. Not to say that, if you have a certain position, you don't think deeply about this stuff, but you start learning more that this certain beliefs can actually be unhelpful in the grand scheme of things. They might be helpful in, dealing with certain issues. Like if someone said to you, like, oh, women shouldn't train because, that's for guys, it's like, it's helpful to have the position that you previously had, where it's like, there's no difference between men and women. Women can do everything that men can do. But then in other things, if we ignore any differences, you kind of get left without actual solutions to the problems that you're facing. It's that difference between like equality and equity. It's like we actually want to build something here where you have access to the resources that you need, I have access to the resources that I need, and then we can go from there. Like we're actually more on a level playing field as a result of that, because we actually have equal access to the knowledge that is helpful for us as individuals, and obviously that broader category, male, female, not so binary, but male, female, that we fall into.
Absolutely. And I suppose that's the big thing, that there are such key differences in our physiology. And I think it comes down to more than talking about equality. And I think it goes back to even how we were taught in school. Like a lot of my clients that come to me have never tracked their menstrual cycle, wouldn't know how to go about that, don't know what hormones are involved, don't know about what different stages that they're in, just their cycle comes once every month. And they don't really understand how they can manipulate, just say like PMS symptoms, how they can manipulate their kind of training and nutrition to help with their bloating, to change their training throughout the month, the nutrition. And they come to me and they haven't not a clue about it. And then once we start to implement a couple of strategies, they really notice a difference in PMS symptoms. They understand their cravings more, why they get mood swings at certain times of the month, why they get more water retention, etc. So I think going back, to school, we never were taught about this stuff. We were never taught about the menopause, perimenopause, postmenopause. And I know an old client was saying to me recently, she's like, what's all this noise about perimenopause? She's around that age herself. And she's like, why are people talking about this now? Like, this is the first thing that I've heard about it. And, this is a woman, in her 40s. So I think, it goes back to a lack of education and kind of taboo subjects, really.
Yeah, and this is like hugely endemic in more, we'll call them conservative societies, and that would be Ireland, especially. Like, the two of us are Irish. I know we have a lot of listeners from around the world, but especially in Ireland, we come from that more, we'll call it regressive Catholic ideology of like, let's push all this stuff. Like previously, like women weren't even allowed in the church if they were on their period. Like that, you just, that you're dirty, that's not sinful per se, but it's like, that's, you're not supposed to be in the church there, So it's like, it's all about brushing it under the rug here. Let's not talk about that. Let's not even look at that. And as a result, the society as a whole, but especially the people that need the education, that want it because it pertains to their life, they have a huge deficit of knowledge here, and that's kind of what we want to talk about throughout this whole podcast series is like, let's actually answer these questions. Let's actually put down the foundations in this episode and kind of the next episode as well. So you have this understanding, and then you can actually start realizing this stuff. Because like you said there with your clients, like I've had a lot of clients in the past as well that have never looked at this stuff. They didn't even know to look at this stuff. They were just like, oh, this is just something that happens. It's not that case. That's being a bit like hyperbolic, but it's like, they just know, oh yeah, it's roughly a 4-week cycle, something like that. And, that's it. It doesn't enter into their mind that this is going to affect their training, their diet, their, ability to do stuff in the world that they want to do. It's like, oh, that's just something that happens, because they still are in that mentality of like, let's just brush that under the rug. Let's not talk about it. Like I have a number of Muslim clients, and it's especially in that culture as well. Because again, if you had like a fundamentalist like Christian person, it would also be very similar, where it's like, let's push that under the rug. So if you have a more conservative Muslim society, you also have that kind of like, let's not talk about that stuff. So it is one of those things where if you haven't ever looked at this stuff, you're going to have to get a lot of education to actually bring yourself up to a standard where you're like, okay, I can actually see how all the puzzle pieces fit together now, and how this actually fits into the broader picture of what I'm trying to create here, so maybe we can go through the kind of life stages here, and then we'll kind of bring it on to certain, we'll just mention them in this episode, but we will be going in more in depth in future episodes. We'll come into some more like again, female specific issues, because I know a lot of people, I've had a lot of clients. I know Brian deals with a lot of clients with this stuff in terms of nutrition. But there's a lot of women out there that have like very specific, like female specific issues that can actually be helped with, changes in their diet or changes in their nutrition. And you don't even need to go to a doctor. Now, that's not to say don't go to the doctor, but it's stuff that you can actually manage or potentially I hate the word, like, fix with, nutrition or training adaptations, or it's something where, okay, I'm actually going to have to manage my training around this issue that I have. So we have to be aware that, first of all, there are female specific issues that we need to educate ourselves about, right? So we'll go through the life stages, we'll just touch on some specific issues, and then we'll talk about, maybe the history, how things have changed, and then we'll go from there. So what is the story here? As far as I'm aware, look, guys and girls, we're the same, pretty much indistinguishable up until about, let's say, 12, it's like, they're pretty similar. You have a guy in a race, you have a girl in the race, they're sub 12, pretty similar results. You're not going to be able to tell a huge difference. But is there a difference before that? Should we be even thinking like, in terms of, let's say, training, nutrition, anything in that I should say, pre-puberty stage? Is there anything that we would be looking at in that stage?
Do you mean in terms of,
just in terms of, like, I don't know, is there anything that we'd be like, oh, there's something to look out for? Women have specific issues here that are just not being catered to. Because I know there definitely are in terms of the education front, because, that's when you get a lot of your, we'll call it like sex education and stuff like that. So I know there's a deficit there, but is there anything else?
So I think, yeah, I suppose going back to education wise, was that, like you're saying, Ireland is very conservative. So it's left us in a huge, I suppose, knowledge deficit for when we get older. But at that age, it still is so important about education around the menstrual cycle. And what you'll find about that age is that young girls start to drop off from things like sports, things like PE. They pretend that they're sick when really they're on their period, they're uncomfortable. So I think more education at that age will have a better retention of girls in exercise, in sport. But at that age, what kind of nutritional and training things should we be looking at? It's really, like, I suppose, what kids enjoy. If someone's around the age of 12, I just encourage them to partake in exercise that they enjoy, have more education around the menstrual cycle. And then, at that age, you're really starting to see a lot of patterns of disordered eating, I suppose, mostly in young girls. You have the influence of social media, you have the influence of magazines, and you have a huge influence from your parents, from your older sisters. If their mom is checking themselves in the mirror, if the way that they're talking about dieting and weight loss can really rub off on that younger age. And you see that quite often in the hospital, as you see, girls that might be 12, 13 that are coming in with, anorexia, bulimia. And a lot of that, I suppose, it's multifactorial, but it really starts in a young age and can be down to simply just from body checking, watching older women body check, the fronts of magazines, and you're seeing celebrities in uncomfortable positions, coming out of the water on the beach, and like, she gained 30 pounds. So it starts really at a young age. But in terms of, I suppose, specific recommendations, it is what a child enjoys, and it's just trying to get them into sport, into nutrition, into fitness. Because I suppose now a lot of us think of nutrition and fitness as something that's aesthetic, and something that's the main driving force. But really, we need to be doing this for ourselves, for our own health. And so we need to, I suppose, redirect the energy from taking away from the power of aesthetics and putting it more towards health. So I suppose that's where I would be going with it with kids.
Yeah, 100%. I'm in complete agreement. Like, you just need to get those, like, good foundational habits, good nutrition habits, just some sort of exercise paradigm. It doesn't need to be like, literally, like you said, like, what does that child enjoy? Maybe they enjoy, I don't know, rollerblading. How can you facilitate that? They maybe enjoy, I don't know, GAA or something. It's like, how can you facilitate that? Obviously there's a huge, gap here in terms of access, in terms of, like, socioeconomic status, where you live, etc. But there's usually something that you can find that your child enjoys that will get them in some way active. And at the end of the day, you could literally do something like, oh, I'm going to, bring my child out for a walk. That is still activity that does contribute to better health, So it's like, there is always something that can be done. Now, again, that doesn't ignore the potential barriers in the way of that. Like, you might say, oh, I'll just go for a walk or whatever. Like, you might not have the time to go for a walk. You might not even have the fitness yourself to go for the walk. But, stuff like that, we have to try to encourage that wherever possible. Then we get into the kind of, we'll say, the teen years into the early 20s. This is where I, like, in my opinion, a lot of, first of all, like you said, women drop off the health and fitness radar. Now, this before, let's just think about this, because I know we want to go on to like the how it occurred over the last few years. But in the previous years, it would have been a case of, okay, I used to play, football or whatever as a child, or even just like during like a break on like yard or whatever. It's like, oh, I'd play football, I'd go around running, skipping, whatever it is. There would be some activity scheduled into the day. After that, like you said, people start dropping off. Women specifically start dropping off a much higher rate than guys seem to drop off. Like, guys seem to keep their sport up for a longer period of time. Now, this could be, like you said, due to like menstrual discomfort, something like that, where like, oh, I don't feel great in my body. Maybe they also have some sort of like dislike of the way their body looks, or moves, or whatever it is. But then also we have to acknowledge that there's also cultural things around that. Like, women might be expected to do more. Like, if you are in a family of 5, let's say, and there's 2 older daughters, those 2 older daughters are actually asked to do more around the house. Like, it's almost like, oh yeah, you're a woman, so you do the housework. Whereas the guys are like, it's kind of facilitated to go, oh yeah, you're a guy, I'll bring you to football training now, or rugby, or whatever it is. Now, that's not always the case, but that does play into it for a large number of people. And then also some of the hobbies, the interests of women are not really as well catered to in the society that we currently live in terms of this, like, whatever you want to call it, Western society. So as a result of that, women kind of drop off all hobbies at this stage, which just leaves them in a position which we ideally don't want, which is, they're kind of just left at home. What do you do when you're at home? You're kind of bored. You're like, okay, I might eat some more. And then also, when you're flicking through social media, you get exposed to all of these different beautiful bodies and beaches in Bali and whatever else. It's like, there's a lot going on in these kind of formative teen years, So what should we be thinking of here? Like, what's going on?
Yeah, so I suppose this is when girls really start to drop off with sport, with exercise. And a lot of that comes to, we've come through puberty now, our hormones are all over the place. Maybe we're starting to be, attracted to other people. And like you said there, a huge part of it is actually the way that their body looks during exercise. And it's not just, the male gaze or male pressure. Like, I remember in school when we had in PE the bleep test, and girls had a pact to drop out at like level 7 or whatever it is. So you'd see literally 10 girls just stop at this one specific level, and that they weren't going to go any further. So this is when you're really starting to see kind of body dysmorphia kick in, and social pressures, and like how a woman should look when they're exercising. You've that, then you've mixed with that. This is when they're really susceptible to things like skinny teas and all these kind of detoxes and really low restrictive calories. Even though when you're 16, 17, generally people are very slim at that age, but it's just kind of never enough, because they're still seeing bodies of older women that are completely developed, and they want to emulate that. But how do we get there? Like, I suppose I'll just drop to really low calories, but they might not even verbalize, they might not know about calories at this stage, and be like, okay, I'm just not going to eat a lot.
Yeah, and that's the thing as well. There's a component of this where obviously we can help here in terms of us, what we do in terms of educating people about nutrition and different things like that. But it is societal pressures, but also it's not just society, like people say this, like nameless, faceless society. It's also an internal pressure. Like, these women are feeling it themselves, and that can be a good motivating factor for some people. Like, it can literally be the thing where it's like, okay, actually, I want to look and feel a certain way. Oh, when I do these activities, I actually look and feel a certain way. So I'm going to keep up these activities. So it can be a positive force, but unfortunately, a lot of the time, it's that very negative, destructive force where it's like, okay, I don't really know what I should be doing in terms of exercise or nutrition. So I'm going to over exercise. I'm just going to do a lot of exercise, or I'm just not going to exercise because I don't like the way I look when I'm exercising. I'm going to wear like really baggy clothes so people don't look at my body. Like you said, like that could be somewhat towards like the male gaze, or it could just be like, I don't feel comfortable with being perceived in general. Like, I don't want people to even think I exist, But then also we have the other side of it where, again, you could be over exercising, and that's not good either. And then on the nutrition front, it's also, again, you generally see one or the other, where someone's like, I'm going to retreat from society. I'm not going to look at society. I'm going to stay at home. I'm not going to be active. And generally, when you're at home and have a lower activity level, like, it actually makes things worse, because then, like, if you're whatever, let's say again, what are teen girls? They're probably between like 50 to 70 kilos. Like, it's like, if you're a 50 kilo woman, like, your overall calorie expenditure just as a baseline is probably not that high. So it is actually very easy to accumulate more fat and overeat if you are just sitting at home, you don't have a high activity level, and then all of a sudden, you're at home, you're eating more, because it's very easy to overeat when you're just sitting at home. And even if you're at 70 kilos, like, it's still your baseline calorie needs are probably still not as high as someone else's. And that is another thing as well. Like, you go out to a restaurant or something, and it's like, oh, I'll have this meal, and that meal is just designed for this average plate. Like, I literally, like, my girlfriend is only about whatever 55 kilos or something, and I'm like 100 kilos. So, like, we get the same plate. If we order the same dish at a restaurant, we get the same plate. She only eats about half of that. I get to eat the other half of it, in case anyone's wondering. But you know what I mean? It's like that, they're not designed specifically for us. And again, going back to that first conversation we were talking about, where it's like, okay, well, we should have like equal size plates and everything. Like, I actually think that's what we should have. But it actually can be harmful, because then all of a sudden you're kind of left in this like social paradigm, especially in cultures like the Irish culture or Arab cultures as well, where it's like, oh, you must finish your plate, and you're supposed to finish your plate. There's, starving kids in Africa. That's what we were all told when we were growing up. It's like, finish your plate. And now all of a sudden we've got loads of different factors that are playing into, like, social pressures or whatever, that are playing into either making you over exercise or making you overeat and under exercise, So in my mind, at least for women, for guys as well to an extent, but it's a little bit easier to navigate for guys. There's a little bit more like clearer paths, if I can even speak. But for women, like, it's very hard to navigate this situation. And as I was saying, like, we can play a role in terms of providing good exercise guidelines, providing good nutrition guidelines. But even with that, it is still far less effective than you're going to see from this like skinny tea or this detox tea, because all you're going to see is some, whatever Z-list celebrity, micro celebrity, whatever. And they're going to be like, oh, I use this to, lose 5 pounds in 2 weeks or whatever it is, and someone's like, oh, that's exactly what I want. That's exactly, I want to lose 5 pounds or whatever it is, and that's unfortunate, because that marketing is very, very persuasive, especially when you don't have the requisite education, the knowledge level to go, oh, this is actually what good nutrition is. Like you said, they're going to go on this like 500 calorie, diet, where they're just like, oh, I heard my fitness pal is good. And you'll see them basically be competitive with themselves, being like, how low can I actually get my calories? Like, how low can I eat on a given day? And this is especially true for certain subsections of women, where they find themselves in these like negative social groups. This is what they, at least from the research I've read, like, you put people in like, these situations, especially women, where they have like eating disorders, and they start encouraging each other. It's like, let's actually, like, they basically make it worse for each other, and you kind of have to separate them if you actually want resolution, which is a little bit different than what you would think. You'd be like, oh, well, they have a common ground, like they can discuss this stuff. But unfortunately, it becomes almost competitive. It's like, oh, well, I lost this much this week, or I only weigh this much now, I'm able to survive on 300 calories per day or whatever. So there's so much going on in these formative years, and unfortunately, this also like is the years of your life that are supposed to set you up for the rest of your life. This is where you're supposed to be getting your education. This is where you're supposed to be, building like bone mineral density. This is where you're setting your physiology up for, your 20s, your 30s, like your more reproductive years and all that kind of stuff. And it's like, this is a huge issue that if we don't actually address it, which is what we're trying to do with this podcast, it just kind of gets swept under the rug. It's like, oh yeah, we know, little Sarah down the road, she has something going on. She's getting a bit skinny these days, but let's just not say anything to her. Let's not say anything about that. I don't know what to do. I don't know how to help her. Just brush it aside, and it's like, it's not really good enough.
Absolutely, definitely. And I suppose, on the topic of marketing there, like marketing these days is just fantastic. I mean, it's really kind of, I suppose, focusing on that kind of scarcity mindset, or, the culture of kind of never being enough. And they really pry on women's insecurities. A lot of this kind of weight loss marketing is directed towards women, and it focuses on, what you should be and like what you're lacking and how that marketing is going to get you there. So, what I find particularly, with clients coming to me is that there's a lot of women who have been trying to diet for like 20 years.
Mm.
And then they come and they're looking for, not necessarily looking for a quick fix, because they know that they've been trying to diet for so long. But they come and I'm like, okay, let's take things easy for a few weeks. Let's get you into a place where you're kind of really eating better and eating good foods. We'll focus on high protein, complex carbs, eat it, like exercising and all the rest. And they often are kind of like, what's the calories, and like, how quickly should I be losing weight? And I'm like, listen, you've been trying to diet for 20 years. Okay, let's take a step back. Let's get you into a better routine before we focus so much on, again, just like trying to be smaller. So yeah, with that age, definitely, I think, things really kind of start, kicking off then. And there's, I suppose, a lot of, we were talking about internal pressures. And I think a lot of the between marketing that we see, a lot of the cultural influences, I think it's not just about other people putting that on you, like you were saying. It's a lot of, I suppose, like, internalized objectification, or internalized misogyny, again, about like what a woman should be like, and what they should do, how they should train, how they should eat. And they're almost self-projecting it onto themselves, and onto other women as well. So it's not just all about, this is what the patriarchy has done. It's a lot of like I said, I suppose, internalized objectification more so than anything.
Yeah, like I always think it's kind of lazy, and I don't mean that to anyone who actually does say it, but it is kind of lazy to just go, oh, it's the patriarchy's fault.
Yeah,
like that's basically just giving us all the power. That's literally just saying that, like, oh,
yeah,
guys have literally all the power. I can literally, through my actions, through my words, completely influence your thoughts, your mentality, whatever. I'm like, guys, give yourself more fucking credit. Like, you have the ability to rule yourself. There's definitely a lot of hurdles, and there definitely is, and traditionally, for sure, there have been more and more barriers, but you still have that power in your hands. And I find it very anti-resilient, if you will, to be like, oh, it's the patriarchy. And it's like, yes, that is a component, and it has played into it, but it's not the solution.
Definitely. But I think as well, when you talk about that, a lot of guys get really, really defensive. And I think, like people our age, they don't think of the way in, kind of the patriarchy. But if you step into rural Ireland, if you go into the hospital and speak to half of our patients, you'll understand that this is still really entrenched in society. And it may not be in your, 20 something year olds like male group, but it's still so, widespread in society. When I know we're going to talk a little bit about kind of women's kind of sport through the ages, and kind of what, fitness looked like for our parents' age versus now. But it's still like very much in society, even though it might not be directly in your friend group. Like we have a lot of patients, and like I'm on the colorectal surgery team now. And, it's people that have had, big surgeries for their rectal cancers. They have stoma bags now, and they need to learn how to manage them. And I don't know how many, how many like, older men you're teaching them. Well, I'm not teaching them how to do it, but they're like, you need to learn how to like empty the bag. And they're like, sure, why would I learn? The wife will be doing that for me. They were like, no, you need to learn how to do this. So it's still just completely entrenched in society, I think.
Yeah, and again, it is one of those things where it's like we can again ignore this, or we can go, okay, this is a problem. How do we come up with solutions for this in future? And again, it comes down to better education, and then better societal education in general. Like this stuff, unfortunately to some extent, doesn't move very fast. Like we wouldn't want it all to just fucking change overnight, because that leaves us on very unsteady ground. Like no one knows what the fuck's happening if society is just shifting day to day. But at the same time, it's like some of these things are clearly very negative in terms of what women have to experience and have traditionally experienced, you know. But anyway, look, we're in our 20s now. Okay, we've gone through these formative years. They were maybe good, they were maybe bad. Maybe you got some fucking awful marketing, maybe you got some good marketing, you know, maybe you found yourself on the path. What are we looking at after this? Like, let's go through the kind of life stages and the different things that are potentially going to come up for women throughout the next few years. And then we'll kind of go into, well, maybe you want to do it while we're doing it, maybe touch on any like specific female issues that might come up. Now, they might have come up during teen years. For example, you might be diagnosed with PCOS or something, or you might have endometriosis. You might have a few different things that can come up, but let's just say, okay, we're kind of moving through it. We're kind of going through the life cycle stages, I should say. What's going on? How does that influence all this stuff?
Yeah, so I suppose separating it out, I suppose, into the reproductive years, and then I suppose the perimenopause, menopause. So talking specifically about the reproductive years and the menstrual cycle, like we were saying, like in school, we're not really taught how to track. We're not taught about we're taught at a very basic level, what the fluctuations in hormones are, but we don't know what that means for us and how that might affect us. And then I suppose specifically to nutrition and training, like there's a lot of studies that are coming out at the minute. Well, there's not actually a lot of studies. There's a couple of studies that are coming out at the minute about how the menstrual cycle and how that might affect our training. And I suppose what's happening now is that the menstrual cycle is such a minefield in that there's so much, not only variation between women, but variation between cycles for the same woman. And so when what's happening is people are seeing studies and they're saying, okay, so during the follicular phase, you should be doing strength-based training and you should be doing HIIT training when you're on your period. And they're trying to kind of, I suppose, really rigidly put in different stages of your cycle, what way you should be eating, what way you should be training. And they're completely, I suppose, like extrapolating the information and being like, even though there might be slight benefits in implementing these practices, it's complete, like, I suppose, extrapolation of the evidence. And when you hear people who are actually researching in this area, like Kelly McNulty from the Period of the Period, she'll take these meta-analyses and say, okay, so what we're saying is there might be, a small benefit of doing, just say, HIIT during your period. There might be, better increases in strength gains, during kind of the late follicular phase. But there's so much female variation that this is just a general guidelines. And the best thing that you can do is track your own cycle, track your strength increases, and track your symptoms. But like I said, what we're seeing is people just taking that evidence and just kind of running with it. And it's kind of a double-edged sword, because I think a lot of people are getting excited about it and they want to know more about women's health, and they're like, I'm going to put this information out here. I know about women and I want other women to know about this. But really it's often not that helpful, and I think like rigidly, getting women to, train and eat during different stages of the menstrual cycle might not actually be that helpful, having these kind of blanket recommendations. So I suppose what I always say is get people to track themselves and not kind of be so based off of these studies that are showing kind of like marginal gains. The most kind of specific recommendations are based on your own cycle and your own tracking, rather than studies that have so much variation between them.
And so this is the thing as well. Like, first of all, for years, women were treated as a confounding variable in studies, so they just weren't included. You're like, oh well, I don't want to have to deal with, like, I'm doing a research study on, I don't know, the best, most optimal training program. I'm like, oh, like these women over here, they have this cycle, so they might have, if I measure them on this week, they might have good results. If their performance could be all over the place, I'm just not going to include them. And that was the way like science was done. Now, fortunately, first of all, people realize that that's unethical, especially in a medical context, because you're like, well, women take drugs as well. So if you're just prescribing drugs that have only ever been tested on men, we don't know what the fuck's going to happen. But also in the stuff that's related to the training and stuff, it's like, well, you're actually not getting the full picture here. You don't actually know what's going on. Like, you're trying to make evidence-based recommendations, and you can only ever make evidence-based recommendations for 50% of the population. because you've only done it in men, you know? So it's great that they're, you know, including more women in this stuff. But again, when you actually get that onto a practitioner level, it can be very convoluted because you have a lot of inter-individual variability. You have differences between like even yourself, where it's like, oh, you're 1 month versus the next month could be completely different, you know? So it's like there's so much variability that goes on, but there's actually better skills to learn to deal with that stuff, you know? Like we always talk about like what's called like auto-regulation, you know, where it's like, okay, let's actually track how you feel, perform, you know, look, all of those different things, and then let's actually modify our, you know, maybe our training intensity on the day, the amount of volume we're doing in a given workout, the amount of volume we're doing that week, you know, different things like that. We're auto-regulating based on the feedback that our body is giving us, you know, and that's a much better way of going about it. However, it doesn't have the same marketing appeal where it's like, oh, well, based on the most recent studies on female population here, well, we should be doing X modality or protocol at this time. And also it has a great marketing ring to it where you can say, oh, we are going to periodize your training to your period. Like it has a great marketing ring, you know, it's like, oh, periodization, period. Oh, it's like, yeah, cool. We're very scientific, you know, but unfortunately, or fortunately, depending on how you look at it, you're much better off just auto-regulating. You're much better off actually just learning to listen to these signals. But unfortunately, that actually requires a bit of, you know, first of all, knowledge of what you're looking for, but then also you actually have to kind of spend a period of time actually tracking this stuff. You know, it's not like I can just go, boom, overnight, we know exactly, we've got 1 month's data even, I know exactly what's going to happen. Because, and I'm sure you see this with your clients as well, a lot of my female clients, they will have a lot of variability. They'll be like, oh, it's not this perfect 4-week cycle. You know, some of them, they're like clockwork. Literally, I'd be like, set my timer. I'd be like, okay, cool. Literally, I know exactly you're on day 25 here. You know, like some of them are like that. But a lot of the time, it's all over the place. They might have one cycle is 28 days, one cycle is 35 days, you know, but there's some relative consistency to it, you know. And then especially in the populations that we deal with, because, you know, people come to us when they have, you know, different issues, you might be like, oh, I had a period, 3 months, no period, a period, 6 months period. You're like, how are you supposed to understand what's going on with that if you are in that kind of oligomenorrheic stage where you're like, I don't have a regular cycle, so how am I supposed to use this research here that has been, you know, crafted this perfect ideal cycle? You know, it's like you're not able to use that research, but you still are able to use the tracking your body, tracking what's going on, auto-regulation. How do you feel? How's your performance going? Okay, let's actually start using that data, you know, to inform how we actually train, you know?
Yeah, absolutely. And I suppose that that's a point that I like to drill home as well, is that, you know, it's not good practice to completely change someone's training just because they're a woman. You know, like there's still like fundamental things that we need to keep in programs. And like you said, like auto-regulation is key. And then so there's between the menstrual cycle, and then you have, if a woman's on a contraceptive, which just brings in a whole other minefield into studies. And then what you see then is that studies are mixing women that are on the oral contraceptive pill and not. And again, just the information, the quality of information just varies so wildly. And then even within the oral contraceptive pill, you have, you know, 20 plus different types, not just the oral contraceptive pill, any kind of contraceptive. But yeah, so it's just a minefield of information. And I think, yeah, the best thing that you can do is track your own symptoms and your own month, and whether that's your natural cycle, whether that's you're on the oral contraceptive pill, whether that's you have like one of the implantable devices. I think that's the best thing that you can do.
Yeah, and this is the thing, like I've seen so much data because obviously like through the years I've had loads of female clients, and it's so interesting to see the differences. Like, you know, a client will be like, oh, I'm on the copper IUD or something, and it's like, okay, you know, I've had 20 clients that have been on that, and this is the general response that they seem to get the next few weeks. This is, you know, things that I might, you know, you might experience, if I can even speak, things that you might experience, things that we might expect, and then this individual just performs completely differently than all the last 20 individuals that I had. So it's like, you have to just be you have to treat yourself as, I was going to say an experiment, that sounds a bit wrong, but you have to treat yourself as, I don't know what's going on until I actually start tracking this stuff, until I actually start listening to my body, until I actually learn about myself. You're basically that n equals 1. You're that, like, there's only one person that matters when you look at all this stuff, and that is you. While we can have good, general frameworks, and that's what we're going to talk about on the whole podcast series, there's still the issue of you need to look at this on an individual basis. What's next then? Are there any specific issues, or is there anything else you want to go on to? Maybe perimenopause, menopause, anything like that?
Yeah, so like even like, in those reproductive years, you have your pre and postnatal and how that's developed over the years. Before being pregnant was an illness, and you should lie in bed and you shouldn't move a muscle and you should eat for two, and all this misinformation, and that throughout the years, and how much that has changed, and I suppose the view of pregnant women and pregnant bodies and breastfeeding and all the rest. But now we have a lot more specific recommendations that we can make, and I suppose we'll go into more detail about that in one of the next podcasts. But why I want to just go through all these kind of briefly is because, like I said, I think sometimes talking about women's health, we can be like, what is the difference? And we do go through so many different life stages. So like I said, between pre and postnatal, then there's the perimenopause, menopause. So it is important to know about these, distinct different types before we can actually, inform on our practices.
Yeah, 100%. So, well, we won't get into the pregnancy stuff today because it's a big old can of worms to get into, even pre, post, during, everything. But then after that, what could possibly happen next? Surely there's not another life stage to go through.
Yes, absolutely. So then we're hitting, I suppose, into our 40s, we're hitting perimenopause, and then menopause, I suppose, being, an exact point in time, and then post-menopause. So perimenopause, I think, like I was saying earlier, it's something that's really only, being talked, a lot of more about now. And I suppose, again, culturally, that's going back to the menopause is seen as something that's really taboo, and women still don't like talking about it, because it's seen as something, that their fertility is gone. And back in, I suppose, however many 100 years ago, it was seen that women were now defunct, and this is where I suppose the idea of like witches came from, was women who were now, I suppose, what we know, going through the menopause. They were caring for younger children, and they were giving like medicinal products from from their knowledge of being a lot older and wiser, and then they were suddenly seen as witches, and I suppose that's where that term comes from. So it's a huge amount of taboo in that area, but I think it's fantastic now that we are talking about it, and there's a lot more information going into it, particularly the perimenopause, and so setting yourself up for postmenopausal age, and it's something that I suppose I talk to even my mum a lot about. My mum, who's in her late 60s, and is a complete menopause denier, and it's just like, she's like, I don't believe in this menopause thing, do you know what I mean? And she's just like, I don't believe it's a thing. She's like, I didn't get any symptoms, nothing. But again, it's completely counterproductive, because like she herself would have like osteopenia, like these changes have in fact happened. And I suppose for anyone that doesn't know, when you kind of hit perimenopause, you start to have anovulatory cycles, your hormones are kind of going up, down, every sort of way. Estrogen starts to decline, which you'll see things like a redistribution in body fat. So just like before, where you might have been holding most of your body fat in your lower limbs, you start seeing more kind of visceral fat distribution around your midsection, like men. With that decline in estrogen as well, estrogen has a protective effect on your bones, on your heart. So this is when things like osteopenia, osteoporosis start to kick in. And this is, I suppose, where I'm coming back to, that we need to start thinking about our health and fitness at a way younger age, and not, just when things start to go wrong, like, fractures due to osteoporosis. Like 1 in 2 women, 50% in women over the age of 50 will suffer a fracture, an osteoporosis related fracture. And I suppose it's no good to start thinking about these things when it's happened. And we need to start thinking about it before we start hitting our 40s. And I know that people don't, go into the gym. They don't wake up in the morning and say, hey, like, I'm going to go, like, decrease my osteoporosis risk. But it is something that we need to know about, that we can start implementing this stuff at a way younger age, that it's going to have such a payoff, like, later in life, for, like, a fit, strong, healthy body.
Yeah. And again, like, because in my family, like, there's so many women, and that sounds a bit weird, but like, I have so many brothers, I have 3 sisters, like, there's so many women in and around my family because we just have big families, right? So a lot of my, like, nephews, that doesn't make sense. A lot of my nieces, like, I have a lot of female nieces. That makes sense, obviously. But I'm like, you guys need to be doing stuff. Like, I'm trying to tell them, like, you need to be doing this stuff, because yeah, okay, cool, it's fun and all to be like, oh, I want to, build my booty, or I want to, get a little bit stronger, I want to lose some fat or whatever. But it's like, you have to also be thinking down the line, because as we talked about in, I think it was 2 or 3, maybe 5 episodes actually ago, we're talking about, like, the death risks, like all the things that people die from. It's like, one of the major killers is, like, you have a slip, you have a fall, you break a bone, you break a hip maybe, and then all of a sudden you're bedbound, you lose a load of muscle, and you're dead within a year, and you're like, oh, well, the fall didn't kill you, but the consequences of that did. And again, then it's like, okay, well, how could we prevent that? And unfortunately, it starts 40 years ago. You're a 60-year-old who fell, and it's like, you needed to be doing some sort of weight bearing exercises, some sort of resistance work, either running, whatever, before that, so that you had the requisite bone mineral density, so that this wasn't an issue when you were 60. But unfortunately, that's a hard sell when you're, again, like you said, getting up in the morning, you're not really motivated to train today, and you're like, that's a problem for future me. I'll think about that in the future. But unfortunately, you're going to think about it in the future when you have a low bone mineral density and the issues start coming about.
Yeah, well, that's a huge thing, and it's something that that we see so commonly in the hospital as well, is that people are coming in with fractures, like you were saying, they're bedbound, and there's such a high morbidity and mortality associated with that people don't see. They think, okay, break bone, I'll, it'll heal, I'll just be on crutches for a few weeks. But when you're at that age, and when someone who's in their 70s, 80s comes in and has a broken bone, when they leave, it's like their confidence is knocked, their mobility might never return to what it was before, and their quality of life obviously is impacted by that. So it's a lot of these things that we don't really think about, and only until it's way too late.
Yeah. Anyway, so look, we're going to keep this going, because we're going to cover this stuff in depth. I'm aware that we're getting stuck into the weeds now, and it's like, we actually want to save some of the good stuff for later on. So menopause, it happens, it's a thing. We'll cover that in the future. Now, let's move on to this. Well, I suppose we could touch on any female specific issues that maybe you want to touch on, maybe just briefly mention some things if you have anything that comes to mind. I know we have podcasts planned that'll go in depth to this stuff. And then I do want to get onto this kind of, transition through the years, the last, whatever you want to call it, the last 100 years, I suppose, of women in sport and fitness and all that kind of stuff. And then we'll kind of finish up on that, outside our bubble talk, because that I want to finish up on that. So any specific issues that women are going to be dealing with, that we might be dealing with, that doesn't even make sense, Patrick, that we are going to discuss on this podcast.
Yeah, so I suppose while we just touched on kind of menopause, while we touched on pre and postnatal, again, something that we're starting to talk a lot more about now is pelvic health. And one thing that, whether you are, a female yourself, a female who trains, who's, had a kid or not, or if you're someone who's training women, I suppose the importance of this subject, and I know it's something that might be uncomfortable for a lot of people to talk about, but actually putting something about, like, whether if someone's like had a child, or even if not, if to say if urinary incontinence, urinary retention, anything is something that they suffer with, to put that on a screening form, with the client. And I suppose this might be something that someone seems like minutia, but it's come up like so many times with clients of mine that pelvic health was never discussed, and then subsequently it's something that really affects their training sessions. I was training a lady back when I did in-person personal training, and I had just taken her over from another trainer. And I remember bringing her over to the TRX, and I think I was trying to get her to do squats. And then she started like jumping. like doing jump. And I was like, oh no, you don't have to do like jumping squats. And she was just like, really? And I could tell by her reaction, you know, that there was something else going on. And I was just like, she was like, oh, you're the last guy, you know, had me doing jumping squats. And I was just like, all right. And after 3 kids, how do you find that? And she was like, not good. She was like, guys don't understand these things, you know. And for her, what this meant was she was, you know, running to the bathroom during sessions. She was always making sure that she was wearing, you know, black trousers. And I suppose the implications of this is that, you know, someone might have anxiety going to a training session. They'll probably never do that session on their own. And there's a way higher drop-off rate for something that, you know, could have been screened so easily on a questionnaire. And I know for a lot of women in that age group, it's something that, you know, they're like, I have my Kegel exercises. I know I could go and do all this. She was just like, look, I'm just dealing with it. And, you know, it's fine. I just want to avoid that. So that is one thing that I think can affect women's quality of life so much. Another consultation that I had recently was for, it's not just something that affects like older women, it's for a young girl, you know, who's on medication essentially for an overactive bladder. And again, unless we had screened for that, you know, I would have been trying to get her to drink like 3 liters of water a day, you know, wake up, like smash 500 mils, when that's actually completely inappropriate for her. So it's something, again, it's a small detail, but it affects so many women. And for something that is just as simple as throwing it down on a forum and, you know, trying to broach the subject can make a huge difference. So there's, you know, between pelvic health, IBS is another huge one.
Exactly. On the pelvic health one, because I do want to actually emphasize that this is something that you're going to see from teens to whatever 90-year-olds, you know. So like it is, you might be listening to that going, yeah, cool, yeah, if I have a, you know, a mother of 3 kids, something I'll look out for. But like you could be seeing this in your 20s. You see this all the time as well in sports like CrossFit, you know, where women will be doing like a deadlift or something and they'll pee a little, you know. Or powerlifting happens as well. And it's like, okay, what's actually going on there? It's like, oh, there's something going on with the pelvis. And I've had clients like that run the gamut between like people with, you know, very we'll call it loose pelvic floors, where it's like, you know, they don't have as much control as they'd like. And I've also had the opposite, where they have a tighter pelvic floor and they're having issues with, you know, the muscles pulling and pushing different things. You know, I shouldn't say it like that, but it's pulling on like the urinary tract, the bladder, all that kind of stuff. And it's like, okay, well, how do we deal with this? Like, if you don't screen for that, you don't ask them, like, you're not going to know what's going on. They're going to be like, oh, well, I can't really do today's session because XYZ. And it's like, oh, well, what is the actual issue? It's like, oh, you can see that I have planned here, I have these, you know, jumping jacks and, you know, medicine ball slams into deadlifts and whatever else. And it's like, they don't want to do that because they know they're basically going to piss themselves at the end of that session or during the session, or they're going to be running back to the toilet and don't want to have that conversation with you unless you actually dig a little bit deeper, you know? So there is like a huge amount to this. There's also other like relatively weird things that can occur if you don't really understand, well, maybe if you do understand pelvic floor conditioning. Like I had a client before that used to just literally, no joke, orgasm when they did like knee raises or hanging leg raises, you know? And it's like, if you don't know what's going on there, it's like, oh, well, what the fuck is it? Like, what's happening, you know? So like, you're going to see these things if you're a coach yourself, or if you're a woman yourself, you might experience these things. And all of a sudden you're like, oh, how do I respond to this in the gym? Like, what do I do? Whether it's like, again, you have to do your Kegel exercises, or you just have to avoid certain exercises, or you have to do some sort of pelvic floor conditioning, whatever it is, this can affect you throughout your life.
Absolutely. And I suppose that's the other thing, is that it's not only trying to screen for, you know, if it affects women, if it affects your specific client, because likely, like, again, pelvic health is so taboo that even putting that on your screening for might, for that woman later in life, it might make them more open to seeking help about pelvic floor issues if they arise. So it's just about, I suppose, kind of breaking those barriers, breaking that stigma. And then later on, you know, let's say you're training them for a year, and then maybe they, you know, have a kid, and then suddenly they're having pelvic floor issues. They might remember that time that you had that on your screening form, and that you might have an understanding of what's going on, and they might come back to you then as well. So I suppose there's so much to it, and it's multifactorial. And again, it's something that is so small, but I think that needs to be kind of, drilled home.
100%. What's the next issue?
So next issue, let's go. So IBS, definitely. And I think people are probably sick to the teeth of hearing about like women and IBS. But I think again, like if you're a coach, it's even just knowing how to adjust exercises if your client is struggling with IBS, and that's like exercises where you might have them, you know, lying on the front doing like lying leg curls. If it's things like hip thrusts, that if they're having IBS symptoms, having like a heavy barbell on their hips, again, this is just another barrier to exercise. So it's about screening for these things. It's about, you know, checking in if they're having those, you know, whether it's kind of like bloating, whether it's cramping, whether it's diarrhea, constipation, if they're having stomach issues, and knowing you don't have to be an expert in any of these things, you know, but it's knowing how to screen for them.
This is also the beauty of the health and fitness world. You might not be an expert in something, but you know, there's someone else in your circle that is, and you can go, oh, I'll refer out to that person. You know, it's like, that's why we built a team. You know, all the coaches at Triage, it's like we built a team because like I'm not an expert in certain things. Gary's an expert in that. Cool. I might do a consult with Gary, or Brian's an expert in that. Oh, I do a consult with Brian, you know? So you need to build out that network. If you're a coach yourself, you definitely need to build out that network. But if you're an individual yourself and you're trying to deal with this stuff, again, you might have a coach, they might not be an expert in this stuff. Don't be afraid to reach out to someone else and ask for their opinion, their advice, whatever.
Yeah, absolutely. But yeah, just knowing what to do, and knowing how to refer, knowing how to adjust exercises, knowing how to adjust nutrition, and I suppose asking questions in the right way, sensitively, and giving, I suppose, women enough room to back out of a question as well. So if you are asking about pelvic health, you know, giving them an opt out, if that makes sense.
Oh, 100%. Like you don't want to make it uncomfortable for people. And that's unfortunately the thing, especially because the fitness industry is, you know, largely a male dominated industry. So you're like, well, I don't want to talk about this with my, you know, 30-year-old client. You don't want to talk about your 20-year-old client, your 30-year-old client, your 40 or 50 or 60-year-old client. You don't want to talk about it. So then you're like, oh, I'll just, you know, I won't touch on it. Where in reality, you should touch on it. If they're not willing, they're not receptive to that discussion, that's okay. At least they know that if the time ever comes, you're willing to have the discussion, you know, and that's the main thing. So what's the next issue?
Those, you know, are the two, I suppose, main ones. Different subsets of that, you know, like you've PCOS, you've amenorrhea, which is huge, you know, endometriosis, a lot of, I suppose, kind of more kind of medical issues, and yeah, I suppose they're all kind of more subsets, but I think like things like IBS is like the, I suppose, main one that we're hearing a lot about.
Yeah, and the thing about it is, especially with the IBS, and actually a lot of the issues that women face, like there are differences in terms of, like I actually did my dissertation for my undergraduate in sex differences in inflammation and depression between like men and women, obviously, you know, and like some of the stuff you're seeing, like you see in that when you actually like really dig into the research, and you're like, Jesus Christ, like we're basically two different species here, you know, and it's like there's a reason why it's more common in women. There's reasons for why certain issues are more common in women and why other issues are more common in men. And if you understand that stuff, it actually gives you so much more, I don't know what the word would be, leeway to actually implement change in your life. You know, you're like, okay, I can actually, this is not something that I have to face alone. This is something that other women experience. You know, this is something that has solutions to it, or at least protocols we can engage in that can manage this, you know? So the way we start with that conversation is by having that conversation. And again, that's what we will do in future episodes. We will actually like dig into this stuff, because even though some of these things are more medical in nature, and it's not like you can just, you know, endometriosis, while there are like, you know, certain exercise things we should be looking at, certain nutritional stuff, like it's not like you can just fix this, magic it away with nutrition or training. But having said that, you should still be aware of, okay, well, what is endometriosis? How does that affect me? Like, what are the likely complications with this? How could I potentially at least manage this in whatever capacity with my nutritional interventions, with my training? How do I do all that stuff? You know, like you don't need to have, again, a medical degree or anything to understand this stuff or to act on this stuff. But again, we need to have that understanding as a starting point, right? So look, we'll get into a load more issues in future episodes, but I do want to just round out this episode, kind of finish up on it. Well, there's kind of two things we want to finish up on this, excuse me. This is the kind of, you know, women in sport and fitness over the years, because it has obviously changed. You know, like I remember, like obviously I was born in 1992. I'm an old lad, right? I'm getting on in years. I'm in the 30s, you know. But I remember when I was growing up, like I saw guys exercise, didn't really see women exercise, you know. Like I saw women exercise in schools, you know. Like I lived beside a school, or I lived beside a school, I should say. I saw women exercise in the school. That was a secondary school, you know. And then I didn't really see them exercise after that. You know, you might see one or two. Like I remember stuff like, you know, Sonia O'Sullivan or something, you know, being like, oh, like, you know, does some running. But that was kind of it. You know, you didn't really see athletic bodies. You didn't really see people, you know, pushing sporting stuff. And that might be just, you know, from a, we'll call it a marketing perspective, like they just weren't showcased, you know, on the television or in ads or whatever else. But I don't think there was as much activity, or activity, I suppose is the wrong word, but it's also the right word. There wasn't as much women in sport and activities back in the day, you know. Now that's obviously changed a lot over the last few years. But let's start wherever you want to start, whatever year you want to start, because I love history, so we can start in the Paleolithic times if you want. But let's talk about women in sport and fitness and how that has changed over the years.
Yeah. And yeah, so I suppose like when you look out onto the gym floor now, there's still a disproportionate amount of men to women. And, you know, I suppose to understand that you do need to reach back. Like I think it was like 2012, it was when women were allowed to do boxing in the Olympics, you know, which is so recently. You know, I think we were talking about before how, you know, women weren't allowed to do marathons because they thought that their wombs were going to fall out, that they shouldn't do impact exercises, that they shouldn't do contact sport because they were going to, you know, hurt their reproductive organs. So this is something that, you know, has, I suppose, been ground through society through the ages. And then when we go back to even like our parents' age, and you know, the kind of exercise on tape, and you're doing, you know, like the step aerobics, and so that was the new standard of exercise that women were supposed to be doing, like a mixture of that, a mixture of yoga, Pilates, you know, gentle exercises. And now I suppose what we're seeing is a lot more women in the gym, which I suppose is absolutely amazing. And I think CrossFit has a lot to thank for that. And I suppose Instagram is like a double-edged sword with regard to that, because it is given a lot of women, I suppose, easier access to the gym. It's you know, a lot easier to be able to follow someone and see what they're doing and being able to replicate that in the gym. But I suppose we have now this whole other era of like body dysmorphia and this other thing that we are pushing towards. You know, if you're like a 90s kid like myself, you know, we grew up looking at you know, Kate Moss, and we grew up looking at the Victoria's Secret supermodels, and that was our standard of like what a woman should be, what a woman's body should look like.
That 2000s Tumblr aesthetic, you know,
Exactly.
skinny legs. I know the
Yeah.
look.
High gap, exactly. And how that's changed to now you're, I suppose, like, you know, maybe more of a Kim K body type, or like, you know, the strong not skinny mantra. But we have just, I suppose, replaced these body ideals in a lot of ways. And you know, a part of that is you know, productive, and another part of it is counterproductive. And I think what we were talking about before is that, like, I like to separate kind of women's fitness into like a couple of different worlds, you know, and one being this I suppose fad dieting world that's full of like skinny teas, you know, IV vitamin drips, and, you know, low carb, and like, you know, Weight Watchers and like extreme diets, which take up like the majority of the general population, like, let's be real, like, and then you have, you know, the rise of the fitness influencer, and they're doing their bits on Instagram, and it's like, follow my workout and like get ready for the gym with me, and showing their like, you know, perfect days. And then you have like another subset of people that, you know what they're doing in the gym. And I kind of like split that again into like two different sections. So people that know what they're doing in the gym, and half of them have a really positive influence. They're putting out really good information. So if you're following someone like, like Meg Squats or Katie Crew, they're really like approachable fitness influencers that are putting out, again, like really fantastic information. But then you have the other side of it, and like both men and women who know what they're doing, but are just like bashing everyone else essentially, and saying like, those booty band workouts are stupid, and like cardio is stupid, and like you should train like this, and you need to train heavy, and you need to, whatever. And again, we're just, taking, instead of kind of building, they think that they're kind of building women up, and yeah, women can be strong, and absolutely, but I feel like it's just kind of redirecting the ideal of what women should be, and just pushing it back, like progressing in a sort of a way, and saying actually women should be training like this, women should be doing this. And I find it kind of like regressive. And I'm really, when people start, going on and like giving out about like booty banded workouts or giving out about influencers, I'm just like, who is this actually benefiting? And I think you can talk about how these things aren't beneficial, and how there are better ways to train, and better ways to do your nutrition without kind of slamming someone else down.
Yeah, like we're pretty modality agnostic here. I'm like, I just want to see people exercising in some capacity. And you see this all the time where people are like, just in the general fitness industry, we're like, this is the only way, this is the way we should do it. If you don't do it this way, you're fucking stupid. What are you even doing? Blah, blah, blah. And that's just not helpful. And you do unfortunately see that a lot marketed towards women, because I don't know what it is, but it seems to be this kind of appeal to authority almost. That's the wrong kind of fallacy that I'm talking about, but it is this kind of appeal to, oh, I know what I'm doing. What you're doing is stupid. You should feel bad. And then when they feel bad, it's like, now come to me, because I'll put you on the path. I will show you the way. And that's how they're getting their clients. And it's not necessarily bad. Like, it is bad because it's bad, but it's not necessarily bad because that individual then starts exercising. The reason it's bad is because that might not be what that individual enjoys. That might not be what that individual actually wants. Like you see all the time, like the vast majority of the health and fitness content on Instagram or whatever is produced, or that is produced for women, is like, oh, this is how I train my glutes. This is the exercises that I do for my glutes. This is how I grew my glutes fucking 5 inches or whatever it is, And some of it's positive, some of it's good. But what if you're just an individual that's like, I'd actually just like running. I just want to know how to improve my running. The vast majority of the content is just not being produced for you. And it's very hard to then just be like, all right, what should I be focusing on in the gym? What should I be focusing on with my nutrition? These people are all talking about these low calorie diets, or these people are talking about I should go on a bulk. And like, it's like, there's so much noise, so much confusion, and it's unfortunate. And I don't actually think it has gotten better. That might be a bit of a controversial opinion. I don't know if you agree or not, but I don't think it's gotten better. Like, I actually think like we're in the same, like I was just discussing with you that like you can go to the British Museum and you can see like, one of the oldest medical textbooks and libraries, they're in cuneiform and everything. I don't know if you can read cuneiform, but like they're one of the oldest medical texts in the world. And they're talking about like, female like reproduction, female things, and how do we deal with this issue and all this kind of stuff. And I'm like, we basically do the same kind of thing in this day and age. I like to think that at Triage we don't, but this is what the health and fitness world does. It's like, here's this random thing that we're just going to say, oh, that's how we deal with this. And it's like, yeah, that's not actually helpful. You're just dictating what this woman should want or what this woman should do, and you didn't even listen to them. You never actually went in and got like, what's the actual goal? What do you as an individual want? Now, I do think certain subsections of the health and fitness world have gotten better at this, but I also think, unfortunately, they fall victim to that kind of, what would you call toxic positivity, where it's like, okay, let's actually listen to you. Let's have a bit more, emotional intelligence here. Let's actually talk to the individual in front of us. But then, unfortunately, a lot of those individuals go into this kind of, you should have unconditional acceptance of yourself. And as we were kind of discussing before the podcast, like that can lead to a situation where, like, if you feel like shit, like imagine you are that, 15, 16-year-old woman, and you're kind of like, I don't like my body. I don't like who I am. You're still trying to figure yourself out. and this person's telling you to just unconditionally love yourself, or that you're perfect the way you are. Like, that's not really helpful. While you might think it is helpful because you're like, oh, you're going to teach them how to love themselves. Like, if they feel like a piece of shit, and you tell them that this is as good as it gets, you're perfect the way you are, where do they go from there? Like, you want to actually help them deal with the things that they have going on. You want to actually help them rather than just building this kind of like, oh, you should love yourself. Like, that's not actually helpful, even though it sounds compassionate.
Yeah, absolutely. And like you're saying, it has just become a minefield of people who are, pro diet, anti diet, and you shouldn't diet. And like, then people are like, no, it is okay to diet. And it's hard to know what to listen to. And there's, like you're saying, so much noise on social media. And like, we have to remember a huge part of this is like clickbait as well. Like, a lot of the stuff that is going up on Instagram, that is going up on TikTok, it's trying to get people to share and to like it. So whether it's like, just, oh, follow my workout, or whether it's like, kind of love yourself, they're just trying to like get people to have that, like, that instant gratification. And like they're like, like following random workouts from random people, that's not really going to help you at all. Okay, it's going to get you into the gym and it's going to get you exercising, and that's amazing. Like, that in itself is a good idea, is a good stepping stone. But like, in the long term, they're just trying to get you to click onto the page. They're just trying to get you to like the workout, share it, particularly if it's like aesthetically pleasing. And then a lot of, yeah, like you're saying, a lot of this stuff with, like you're saying, like toxic positivity, like, no, it's fine, like just try your best, like just, do this, everything's fine. And there has to like come a certain point where you're just like, no, I'm actually gonna, kind of try a little bit harder. I'm gonna like do this for myself. I am gonna put more of a focus on my health. I'm going to try and train a little bit harder. I'm gonna, try and improve like all these facets of health. And I'm not just going to say like everything is blanket fine.
Yeah, 100%. And this is also just to finish up on this. We, like, in our little bubble, when we look at individuals, we follow certain individuals. But like you said earlier on, when like you're interacting with the general public, the beliefs that they have, the knowledge that they have about these different things, whether it's, just female health in general, or it's exercise in general, or it's nutrition in general, or it's exercise or nutrition for a subset of whatever it is, like, it's actually very poor. And we kind of get lost, especially in the fitness industry, where it's kind of just this like a circle jerk, where it's like, oh, I just want to put out content to, impress my following, impress my peers, and show, oh, I actually know this stuff. I have knowledge on this stuff. And like, we all fall victim to it because we want to seem knowledgeable to our peers, but it actually isn't helpful in a lot of cases, and it does, like, it has this kind of bubble effect where, you only listen to the voices in your bubble, and, it's like, oh, like, I think the industry is getting better because of this, when in reality, it's like, if you actually look outside that bubble, I can't even speak, outside that bubble, you realize you're like, okay, well, actually, the vast majority of people are not in good health. The vast majority of people don't know what to do. The vast majority of people are actually exposed to really fucking shit information. Like, if you just go down to your local, whatever, Tesco or whatever store around you, pick up a magazine that's, for women, whatever it is, you look at that, there's going to be all these random, like, fitness, health, nutrition advice. You're like, what the fuck is going on? Like, I remember when I was trying to like learn about this stuff, like, I was going to like, like, if you can even speak today, when I was going to like the local library, I just want to learn about nutrition and, different things like that. Or I'd go into like, a bookstore, get a nutrition book, or, even just getting magazines like Men's Health and all these different things, and a lot of the stuff was actually just pure fucking crap. And me as like a 15-year-old, 16-year-old, when I'm trying to learn about this stuff, like, the information was so bad. But I can imagine if you're a woman, it's even worse. But also, I remember distinctly thinking, because a lot of the content that you'd find just in a library or whatever is dictated or dedicated towards women, like, because it's like, this is an easier market. We can sell to these women. We can sell this fat loss diet. We can sell this whatever, because, like you were talking about, you have these clients that, that come to you after 20 years of back and forth dieting. Like, I always call this the health and fitness merry-go-round, and they literally are around and around. They go, oh, they do this diet, they do this detox, they do this whatever, and then they step off and, they're in the exact same place that they were 20 years ago, but also, and this goes to the kind of approach that we take, they step off that health and fitness merry-go-round and they're dizzy. They've been around that a few times. So what we really need to do in that initial stage is actually create some stability. We need to just get some basic good habits, and then we can start really, going towards a specific goal when you're out of it. Like, I couldn't tell you the amount, and we will talk about this when we're talking about like amenorrhea and different things like that, but I couldn't tell you the amount of clients that I've had that come to me and they're like, I have an aesthetic goal, I have this certain goal, I want to reach a certain physique, and we get them out because they come to me because they have amenorrhea or something. We get them out of that, we get them some more food, we get them, more realistic exercise patterns or whatever, and then they're like, Jesus, I actually don't want that. I was looking for that for the last 5 years, and I, basically dieted myself into this amenorrheic state, but it wasn't actually something I wanted. I wanted to feel strong. I wanted to feel fit, athletic, whatever it was. And once we get to that, they're like, I actually don't want to change my body composition. They might want to change it a little bit. They're like, oh, I wouldn't mind, growing bigger glutes or my shoulders or whatever, but it's not like this obsession towards getting leaner, So you kind of have to step back. And it's unfortunate that, unfortunately, that's not what the vast majority of people are exposed to. They're exposed to this crash diet, lose 15 pounds in 2 weeks, blah, blah, blah,
Yeah, no, I mean, like once you step outside the health and fitness world, like things do start to get wild. And I don't know how many, consultations that I had with people, particularly when I was working in the gym. They're like, yeah, I want to lose weight. And I'm like, okay, this is mostly going to come down to your diet. And they're like, what? Like, what do you mean? A conversation that I had with someone yesterday in the hospital, she was just like, oh, I want to lose a few pounds. And she's like, what should I do? Exercise? And I was just like, yeah, I mean, you're mostly going to look at your diet, kind of what you're eating. And she's like, oh, really? Like what? Low carb? And the conversation just, like you can imagine, just spiraled from there. Like I had a client once, and again, like a woman who had a big like corporate job, and she was was carrying a good bit of weight in her 40s, and she was quite reserved about what she was eating. I'd be trying to, she definitely wasn't going to use my fitness pal or anything like that. So I'd be like, maybe if you can maybe do a food diary for one day, or if you can send me photos. I tried a couple of different techniques, and she was just quite like reserved about what she was eating. And then I was like, okay, so like run me through like what you ate today. And she was like, oh, no, my diet is good. My diet is good. I'm snacking on apples, And I was just like, okay. She's like, yeah, just constantly snacking on apples. And I was just like, okay, how many apples are we talking here? And she's like, constantly, I'm just always snacking on apples. And I won't say her name, but I was just like, if you're eating like, 5+ apples a day, you're trying to lose weight, you're a 5'6" woman. I was like, you could be eating like a third of your calories just on these apples a day. And she's just like, what? Just completely like news, just like, and I think just, yeah, the quality of information that's out there is terrible. And once you actually start talking to people outside of health and fitness, like you start to realize how much room for improvement there is in like public health measures, in schools, in workplaces.
Yeah, there's a lot going on. And luckily, we've just started a podcast series on all of this stuff. So in the coming episodes, we will dive deeper onto a lot of the stuff that we brought on in this episode, but also a lot of stuff that we didn't cover in this episode, because there's certain things that they kind of just need an entire episode on their own. Some things, you kind of need to build that knowledge, as we said. You kind of need to, just like we did with this episode, just, bring awareness to a few different topics, make, a note of, oh, this is a thing, this is a thing. But then there's some things that we need to actually build some knowledge of what the physiology is, like what's actually going on, like why do you have a menstrual cycle, like what's actually going on. Like you said, you don't get that education. Well, in Ireland you didn't anyway. You don't get that education of like, well, what do these cycle, like why is it happening? Well, what's going on when it's working correctly? What's not going on when it's not working correctly? Do we actually have any levers to pull in terms of influencing that stuff? Which we do in a lot of cases. But again, there's other things as well. Like we said, there's certain medical things where we don't have as much leeway in terms of what we can do as coaches or as individuals. A lot of them are in the medical sphere, but we do still have an impact with the dietary stuff, the training stuff, or the issue at hand might impact on what we're doing with all this other stuff. Like we just touched on, like you could have endometriosis or something. You could be like, okay, well, what does that actually mean for my training? How do I actually alter that? But anyway, we're going to wrap that up here. It was a pleasure having you on, Nicola. You do have coaching spaces available if people are interested, so like if you're enjoying this stuff and you're like, oh, I want someone to help me navigate this stuff, Nicola is the woman for you, the doctor for you. You hate being called doctor, but Dr. Nicola will sort you out. But also, if you're interested, guys, we do have content in the Coaches Corner. We do produce content on our social media. Nicola's always posting stuff about female-specific stuff. So if you're not following there and you want to learn more about this stuff, the links, etc., are all in the description wherever you're listening to this on. The links are there somewhere. So follow us, social media. We do have stuff in the Coaches Corner on this stuff. We will have stuff in the future about this. But the main thing that you can do if you want to learn more about this is actually just subscribe to the podcast, because for the next maybe 10, 15 episodes, we're going to be talking about this stuff. So do you have any parting words, Nicola?
No, just keep following the podcast to learn more.
Fantastic. Anyway, peace out, guys.